for renal or GI things, colon cancer, and that's about it. That's about it. Some sub-Q Aracid will give in the home. Sometimes it's that chemotherapy.
So those chemotherapy through the IV or just?
Yes, through an IV. They have a central line.
Is it drip?
No, it's on a pump. It's on a portable pump. There's a little pump that they'll carry around in a fanny pack, so they can be mobile. Carry it along with them.
Home care nurse need to when the administration that chemotherapy is finished, then go.
Yeah, the home care nurse will come in and hook up the bag. Usually the chemotherapy runs for a 24-hour period, so then the home care nurse is scheduled again the next day to come in and change that bag. And it's running, it's usually over a 5-day period. And then at the end, when it finishes, then they'll flush them off, and then they'll be set up to see their doctor in clinic. They'll all, as a follow-up care, and then the home care nurses will continue to see them to draw the blood, to monitor where their blood counts are at, and watch for the neutropenic fevers and so forth. They report back to us, and then we see if they need to be admitted, then we may admit them into hospital. But usually not. Usually we'll try to start IV antibiotics, and we rely on the home care nurses to take care of that.
Any problem?
Any problem?
When you say maybe 24 hours.
And if they're
the nurse
given
doesn't stay there.
They're covered home. And there's a phone number they would call. They have 24/7 coverage.
Right, they call us, and if we need to go back out, we go out.
Because sometimes it's
2 in the morning.
Yeah. There's a nurse on call that would go out and make that visit then. We'll try to troubleshoot over the phone if we can. Because usually most of the calls are the pumps are alarming. You know, they either slept on it, kinked off the tubing, something like that.
And the doctor, sometimes doctor come with a home care nurse. No.
Very seldom do we send the doctor out to the home.
But who writes the order?
The doctor does, and then we give it, yeah.
Okay.
The doctor sees that patient in clinic right before they're going to start that therapy.
And then they fax us the order.
And we give them the orders to the home care. And then their pharmacist prepares it, and then they take it out to the home.
And the insurance covers all the medicine and the home care?
Yes, that's what we check out. Financial, we have our financial counselors check on their benefits with insurance. And if they do cover it in the home, then great, we'll do that, and we'll allow it to be done.
Medicaid?
Medicaid, yes. Medicaid is good, but Medicare, no. It's usually, they do not allow us to treat the patients in the home. They want them in a hospital setting.
Medicare has Medicaid, no?
Medicaid, yes.
Oh, Medicaid.
That's our public aid, yes. That's for our patients that have no insurance benefits and so forth. And if they're disabled,
poor.
they can apply, yes.
For poor,
for poor people, yes. That are under the age of 62 for females. Because when you're 62, here in Illinois, and if you're a female, you can have Medicare, which is a government-based covered insurance for you.
We don't have
and 65 for men. And 65 for men, then you can be covered under Medicare. So you have insurance. That's why most people, women wait till they're 62 to retire, so then they can have their Medicare kick in. And the same with men, they'll wait till 65 to retire, so that they do continue with insurance coverage until that age.
Do you have a question of management of other symptoms? The nausea, wellness problem? She's asking, what guidelines do you have for that type of management? Like assessment? Do you have form?
Yes. For our patients, there's guidelines that is set up, and we teach them that if they're having so much nausea, they'll be taught to take either Compazine or Ativan, things like that. For, Zofran, sometimes used in the home. to treat those symptoms.
你什么呕啊、想吐啊，他有药写的，上面有药，你就可以用。
A lot of times, just trying to find what works, trial and error.
试看怎么用，这个药有没有用，那个药有没有用，这样子。
When we discharge them, we do tell them that if they're unable to keep, their medicines down, they need to call the triage line or call their home health nurse and let us know right away, because a lot of the medications that they're on, if they're not taking them, could be very detrimental to their
因为有些
outcome.
人没有跟着他们说要用什么药的话，就很难了。